Hi, welcome. I'm Jamie Callie with RWJBarnabas Health Medical Group. Today I'm joined by Dr. Carpio, and we are here to talk about diabetes for Diabetes Awareness Month. Welcome, Dr. Carpio. Thank you for joining us today. And thank you for everyone joining us here on the video as well. We're going to dive right in today. Want to get started with the difference between type 1 and type 2 diabetes. I know that there's a little bit of a difference, and we tend to talk about it just sort of as diabetes as an umbrella term, but there are some differences between the two types.
All right. Oh, hi, everybody. So yeah, it's a pleasure being here. All right. So for type 1 diabetes, usually it happens to people at a younger age. It's more, it means that your pancreas, which is an organ in your body, is unable to produce insulin. And insulin is something that's supposed to help control the sugar level in our bloodstream. And the reason that your pancreas can't produce the insulin is because your immune system, for some reason, is attacking the part of the pancreas that produces insulin. Meanwhile, type 2 diabetes is really, it's called insulin resistance. So usually this happens to people as they get older, more so like more like an adult onset type thing. And it means that either your body is not responding as well to insulin as it normally does, or at this point in time, your body isn't really producing enough insulin at all. So the way that it starts producing almost no insulin at all is because at first you just have this insulin resistance going on, and because your body isn't responding to the insulin, you still have all this sugar flowing in your blood, and your pancreas knows that, so then it starts secreting more and more insulin to try to normalize the sugar level in your body. Over time, as years pass, the pancreas working so hard starts wearing itself out. As a result, it just doesn't produce as much insulin as it used to. As a result, that is type 2 diabetes. Usually the way we measure the severity of somebody's diabetes is with the hemoglobin A1C level. That's usually done as a blood test. I know some people have like a machine at home that can check it. I don't know how much it costs, but your doctor can also order the blood test when they do the regular labs or routine labs. The hemoglobin A1C tells you your average sugar level over the last 3 months. Mm-hmm. And usually the insurance usually covers it. Once when you do your routine blood work, it's found that your sugar level is abnormal, because usually your doctor asks you to fast for your blood work, maybe for like 10 to 12 hours. So if it's high, then they add on or tell you to come back again for more blood work, and they do this hemoglobin A1C test. And if it's 6.5 or higher, that means you have diabetes. If it's between like 5.7 to like 6.4, that means you're pre-diabetes. So that means like you're not able to metabolize glucose or sugar as well as you used to. You're starting to develop that insulin resistance.
Okay. Yeah. Excellent. Yes. And when you said sort of routine blood work, that's when you sort of see your primary care physician, yeah, and you do that annual exam, right?
Yeah. Usually it happens like in the annual exam, because if you assume like most people are healthy, the first time you meet them, especially when you're young, mm-hmm. Some people usually get like once a year, they get like a cholesterol level. They get a test called the BMP or CMP that mm-hmm. checks your sugar, potassium, and then other electrolytes in your body. But yeah.
Mm-hmm. Yeah, excellent. Thank you. I really appreciate the intricacies of the differences of the two, because I think, like I had said at the beginning, we sort of just call it diabetes, but there is a really big difference between type 1 and type 2. Mm-hmm. What would you say are some common risk factors, either for type 1 or type 2 or both?
Well, there are uncontrollable risk factors and there are risk factors that you can control. So one thing that you can't control really is, your genes, unfortunately. So if you have like a first degree relative, which means like your mother or father mm-hmm. has diabetes, whatever, type 1 or type 2, then there's a higher risk that you might develop diabetes in the future.
Okay.
But, if you're aware of these risk factors, that's another reason why you should, go to your primary care doctor, or then go see them, once a year at least, to get your, sugar level checked. Then some risk factors that are controllable would be like if you have a history of high cholesterol. And then another one would be like if you have an elevated blood pressure, they call that hypertension. So like the main thing is you want to just make sure you can keep them under control. Like for the blood pressure, make sure it's less than 140/90. For the cholesterol, try to make sure it's within normal limits. And another thing that's an uncontrollable risk factor too, it's kind of the same as genes. There's family history, and then the other thing is your ethnicity. So they say that African Americans have a higher risk of having diabetes. Hispanic people have a higher risk of having diabetes. American Indian, American Hawaiian people also have a higher risk of having diabetes. Also, another thing, an interesting fact is if you were pregnant, right? And you had a condition called gestational diabetes, which means that you just had diabetes during your pregnancy only, and then it went away. Even though it went away, it means that you have a higher risk of developing diabetes type 2 in the future, even though it went away.
Oh, okay.
Another thing, it's another one. So there's 3 types, and there's gestational diabetes, type 1 diabetes, type 2. Yeah.
Excellent.
So if you have the gestational diabetes, then that means that you have a higher risk in the future actually developing the regular type 2 diabetes. And then also, let's say if you were the one if your child, if whoever is the child who you had gestational diabetes with, that child has a higher risk of having diabetes when they get older.
Oh, wow. So a lot of genetics goes into it. I mean, it's not, the only factor to it, but it's a lot of genetics. I was not aware of the connection between the gestational diabetes and the child. So that's really interesting. In terms of treatment options, so I know we just talked about some scary, if you fall into a couple of these categories, definitely want to start, having those conversations with your primary care physician, or, finding a primary care provider so you can talk about your risk factors. But if you are diagnosed with either type 1 or type 2 diabetes, or even, I guess, gestational diabetes as well, what kind of treatment options are available today to people with diabetes?
Well, it depends. So for type 1 diabetes, since your pancreas is not able to produce insulin, because insulin, remember I told you, is the one in charge of helping regulate the sugar levels. So in that case, the best treatment is you have to be on insulin.
Okay.
The best one to do it because you need insulin. The people with type 2 diabetes, so they're still able to produce insulin to some degree. So for those people, when they need to control their sugar level, they have different options. The way that the doctor gauges it usually is by the hemoglobin A1C level, which is the severity of the diabetes. So if your A1C is like, typically if it's 7.0, that means you're controlled. So that's good. So whatever, technically if you're still at 7.0 or less, you can just be on a regular, just be on your diet. Just try to maintain a diabetic diet, like a low sugar diet.
Yes.
But if it's more than 7, medication options you have would be like metformin is usually the first one people choose. You got to be careful though, because when people start metformin, they're prone to some side effects, nausea, diarrhea. So sometimes it takes maybe like 1 to 2 weeks for the body to get used to it. If you're able to be patient, try to wait it out. But of course, if it's too severe, let your doctor know, because there are other options available. So let's say you got maxed out on metformin, or for some reason you could not tolerate metformin, the side effect. So then the next one would be a next type of medication. The class of family it's called the GLP-1 agonist. So some common brand names that people probably are aware of would be like Trulicity, Victoza, Ozempic. So the GLP-1 agonist also, so it actually works on a hormone called GLP-1, and this GLP-1 hormone helps control your hunger level, like controls like your fullness, the satiety.
Okay.
So, and it also helps with regulating the sugar levels. So one useful side effect is that some people, you end up losing weight. They say that the GLP-1 agonist helps improve A1C a lot, like mostly by like 1 to 1.5 points, depending what brand you use. So that one's pretty good. And then the next one that you could use also, the next one would be the name of the family is called SGLT2 inhibitor. So some common, brand names that you might hear be like Steglatro, Farxiga. So that medication, these are all tablets. So that one is good too. That one's also good for you if you develop complications of diabetes, or like sometimes some people end up having issues with the kidneys. So they secrete protein in their urine. So that's good. It helps prevent the progression of kidney disease and diabetes. And then also, by the way, for the GLP-1 agonist, so that one, like the ones I mentioned, the Trulicity, Victoza and stuff, those are injectables. Some of them are once a week. The other one is like daily, depends which brand you're using. But GLP-1 agonist also comes in a tablet form.
Okay, so you do have some options.
Yeah, there's some. Yeah, so that one, there's a tablet form called semaglutide. Then everybody has different insurance, so you have to be careful with the insurances. Another one that's common some people use, the class is called sulfonylurea. So some common brand is like glyburide, glipizide, and with those medications, though, what you have to be careful with is that it can cause hypoglycemia, which means that your blood sugar becomes a little too low.
Okay.
It's too strong of a dose. So there's like the top 3 families of medications that are like tablets, and then also there's the injectable from, like I told you, for the GLP-1 agonist, the Ozempic. But then after that, if you're maxed out on all those or something like that, for some reason you can't tolerate any of those medications, or if your A1C is like very severe, like 10 or greater, your doctor might recommend that you be on just insulin. Also,
same as a type 1 diabetic.
Yeah, it's a type 1 diabetic.
Okay.
At one point too, like depending how severe the diabetes is, the patients are supposed to check if they're on insulin, they have to check it at least before breakfast, like fasting, and then 2 hours after bedtime. But if for some reason, they have to keep like a sugar log, it's recommended to keep a log of all their sugar levels. But if for some reason, so insulin is like a once a day medication usually. Sometimes the dose can be split. Depending, you have to talk to your doctor about it. Depends how high the dose becomes. But at some point, if the fasting sugar level, the before breakfast sugar level is normal, even whatever insulin you're using and whatever medication regimen you're using, you might have to be on something called like a rapid mealtime acting insulin. So you take this insulin, it's like a short acting insulin that you take at mealtime. Like some people have to take it. Usually, some people take it first at their biggest meal. The biggest meal usually is the one that is the one that you develop the highest sugar level with.
Okay.
And then you have to then after that they have to adjust it accordingly to see if breakfast is the one causing the issues. Is it lunch or is it dinner? Because the goal is ultimately to get the A1C to at least 7.0. And of note though, as people get older, like when they're like more than 65 years old, depending on who the doctor is, sometimes they might be a little less strict regarding the A1C. Sometimes if you're a healthy person who's more than 65 years old, and they might say the A1C just has to be 7.5.
Okay.
They give you a little break.
They give you a little break, that's good to know. I just want to touch on just a few points. So one thing it sounds like is that treatment options are really specific to the individual for this, because it really depends on how sort of your body responds, both to, at least for type 2 diabetes, especially like what you're eating and then the type of treatment method that you're working on, right? I know you mentioned keeping the sugar logs, testing your sugar throughout the day. And the other thing you mentioned was low sugar diet. Could you just talk a little bit more about the diet for a moment? Like
Yeah.
things to avoid, or maybe not avoid, but things to eat definitely more in moderation of,
Yeah.
that sort of thing.
All right. Yeah. So some general advice I give to people is like, try to like, if you ever like eat, like if you're gonna eat rice, choose
Mhm.
brown rice over white rice. If you're gonna eat pasta, if possible, try to choose the whole grain pasta.
Mhm.
Um, Try to limit like red meats and sweets to like no more than 2 days per week if you can. And then, it's understandable in my opinion, there's gonna be days where, I mean, you're having a party or something like that.
Mhm.
There's gonna be days, but if you're eating desserts, try to do it in moderation, okay? And then also, one thing I also recommend too is that, sometimes, your doctor is gonna see fluctuations in A1C maybe every 3 months,
Mhm.
but if there's a spike, talk to your doctor about it, tell them maybe there was something going on in your diet because there were more
Mhm.
events going on lately. I mean, um, let them know maybe you were having there are other external factors going on. Nobody
Mhm.
knows what's going on there. Like maybe it was more difficult um, to cook at home for some reason, so you're
Mhm.
eating out more. So let your doctor know, because if you feel that, in my opinion, if you feel that you can make a change in your diet or whatever, make your lifestyle changes
Mhm.
um, in the next 3 months, then I think you'll give them another chance to see what happens. But if it's
Okay.
persistent, then you might need like a medication adjustment. Also, another thing is regarding the low sugar diet. Even though fruits are healthy, be aware that the natural sugars in fruits, like some fruits, are
Mhm.
high in sugar, and other fruits are low in sugar.
Mhm.
So, like some fruits that are low in sugar would be like the Granny Smith apple. So that one's like the green apples that you see in the
Oh,
street. They say it's lower in natural sugars compared to the other apple brands that are available, apple types.
that's
Um,
so interesting. I wouldn't have thought that there'd be such a difference between,
yeah,
I guess, what's not exactly the same fruit, but you think an apple is an apple, kind of.
yeah, but you have to be careful. You have to just be aware. There's so many different things like, and then I guess the main one I think you have to be careful with is the high sugar fruits, right?
Mhm.
So it's like watermelon, peaches, oranges. So I mean, it's good to have it, but just be careful how frequently you consume these products, because
Mhm.
that also might be the cause or like the culprit of your elevated sugar level. That may be contributing to your high A1C. Another
Yes,
thing
yes.
also, oh, sorry.
No,
Um,
I'm thinking of like all those summertime fruits and
yeah.
everything.
Another thing also would be, of course, trying to make sure you exercise regularly. If you feel like you need to lose weight, try to lose weight, um, because weight loss also helps reduce the A1C too, to help keep it under control. Yeah.
So these are some of these are like really practical,
Mhm.
good pieces of advice. And I like what you said about, trying to reduce, like red meats and sweets to, like 2 times a week, because I think sometimes we tend to look at, when we try to make healthy shifts as sort of like an all or nothing, like,
Mhm.
well, I have X, Y, and Z, so I have to get rid of this whole food group or something like that. And that's really hard to just sort of
Yeah.
like eliminate whole sections out of your diet. So I think that's a really practical piece of advice. And it makes it feel like, at least for myself, I'm thinking that must feel like so much less daunting to say, okay, like I can have, like maybe
Mhm.
I'll have a steak this week, but maybe I won't have any next week, or again, thinking about summertime, if like you're at a barbecue or something, it's okay to have a cheeseburger,
Mhm.
as long as you're not having maybe a cheeseburger every day that week or
Yeah.
something. uh
Mhm.
so it's definitely something that makes it feel like a little less scary when you're making those shifts.
Yeah.
So I know we talked about some good diet tips. Definitely exercise is always, there's very few webinars that I host that's not at least mentioned as just like a general overall health plus. We talked about some medications. Is there any other tips you give to your patients with diabetes to
Mhm.
help them, manage their diabetes?
Another thing is like, depending on, how I told you, like some people, they have to use that rapid acting insulin,
Yes.
for the, so
Yes.
it's important to make sure you keep, when it's time for your doctor's appointment, make sure you keep a log, because
Oh.
for insulin and that mealtime insulin that people use, the units have to be adjusted, the dose has to be adjusted. And when you know the sugar levels, it helps because at least for the last few days, or at least give them the last few days of your last sugar readings. That might be helpful.
Yeah.
Yeah. Because
So I
sometimes
think
people bring it, but luckily they remember from the top of their head, so that's good.
yeah.
But I feel like when there are more, everybody can remember just the first one in the morning, but it's hard to remember all 3 or 4 sugar levels that they take if they have to take them.
Especially if you're taking multiple throughout the day, it's a lot of numbers to manage.
Yeah, because I've seen people when they report it, they report it like every 2 weeks, say this is my insulin, this is my sugar level and everything. They went down from the A1C from 12 all the way down to 7 or something, in 4 months, 5 months. Yeah.
Which is great.
Yeah.
So I think the big takeaways here is definitely talk to your primary care provider. And if you don't have one, certainly look for one. So you can start having these conversations about your risk for diabetes and have your annual blood work so you can get checked. And just some really good practical tips in terms of management, take your medication as prescribed by your physician. You keep logs of whatever you need for your sugar, if it's 3-4 times a day, so you can have those really great follow-up conversations. Sensible low sugar diet and moderate exercise. I mean, I know it's probably an oversimplification. It's a lot on a day-to-day to manage all that, but I think that these are really practical tips for people to take away.
Also, sometimes also another thing is regarding exercise, some people are if you really have troubles, when some people think about walk 30 minutes, 5 days per week, going outside, but if you really have trouble going outside for whatever reason, just walk inside your house for 30 minutes, try to get the steps in if possible.
Yeah, absolutely. I mean, it's I know with the colder months, it's not always feasible, especially snow or very cold rain. You don't want to necessarily be doing that outside, but lots of great exercises to do at home that you can find that you can do in a much more appropriate climate. Well, thank you so much for joining me today, Dr. Carpio. I really appreciate all the tips and advice you gave, and just the really detailed information for people who either have diabetes or might be concerned that they're at risk for it. So I appreciate you joining us today, and I hope you and everyone have a great afternoon.
All right, thanks, and you too.
Bye-bye.